Many of my patients come into the clinic resigned to the idea that constant phlegm and throat clearing are simply inevitable parts of getting older. You've likely told yourself it's just your lungs showing their age, but in my years of clinical practice, I've found that this is often a misleading myth. Think of your throat like a delicate highway where the cleaning crew has gone on strike. The debris builds up not because of a storm in your chest, but because a hidden system is out of balance. I've seen this stuck sensation embarrass people during quiet church services or family dinners, yet standard syrups almost always fail. This isn't just an annoyance. It's a silent thief of your social confidence and your independence. When you lose the ability to speak clearly or feel comfortable in public, you lose your sense of control over your own life. I'm Dr. Eric Whitman, and today I'll show you a practical root cause plan to clear your throat for good. To get started, please comment with your city or state below. Before we dive into the specific culprits behind that nagging phlegm, I want to take a moment to reframe how you think about your body. Most of my patients look at mucus as an invader, a disgusting substance that has appeared out of nowhere to make their lives miserable. But as a physician, I see it differently. I want you to start thinking of mucus not as an enemy, but as your body's most dedicated security system. In the medical world, we have a very specific way of looking at the lining of your airways. Imagine, if you will, a vast, delicate wall that stretches from your nose all the way down into the deepest recesses of your lungs. This wall is constantly exposed to the outside world. Every time you take a breath, whether you re-walking through a park in the spring or sitting in your living room, you are inhaling millions of tiny particles. We're talking about microscopic dust, pollen, fragments of mold, and even viruses and bacteria that are invisible to the naked eye. If these particles were allowed to land directly on the delicate cells of your respiratory tract, they would cause immediate inflammation and infection. To prevent this, your body produces mucus. I like to call it biological flypaper. This mucus is a thin, watery, and incredibly sticky layer that sits on top of your airways. Its sole job is to catch those invaders the moment they enter. It traps the dust, it entangles the bacteria, and it neutralizes the irritants before they can do any real damage. Now, if we have flypaper catching debris all day, we clearly need a way to take the trash out. This is where your cleaning crew comes in. If you were to look under a high-powered microscope at the lining of your throat and lungs, you would see something truly miraculous. You would see millions of tiny hair-like structures called cilia. I want you to visualize these as millions of microscopic brooms, all lined up in a row. These brooms don't just sit there. They move in a perfectly synchronized rhythmic wave, very much like a field of wheat blowing in the wind, or a stadium wave at a ball game.
Their mission is to sweep that flypaper, which is now full of trapped debris, upwards, away from your lungs and toward your throat. Under normal, healthy conditions, this happens so smoothly that you don't even know it's occurring. You swallow that mucus instinctively, it goes into your stomach, and your stomach acid, which is incredibly potent, destroys everything. It is a perfect, silent, self-cleaning system. So why does it start to feel like a traffic jam in your 60s and 70s?
When you feel that phlegm stuck in the back of your throat, what you are actually experiencing is a breakdown in this self-cleaning cycle. In my experience, this breakdown happens for two primary reasons. Either the volume is too high or the viscosity is wrong. Imagine a 4-lane highway. If there are too many cars, meaning your body is overproducing mucus because it feels attacked, the highway clogs up. That's a volume issue. But there's another more common issue for seniors. The cars themselves change. Instead of sleek, fast cars, imagine the highway is suddenly filled with heavy, wide, slow-moving trucks. The mucus has become too thick, too sticky, and too heavy for those microscopic brooms to move. The cleaning crew is working as hard as they can, but they simply cannot sweep this heavy sludge uphill. This creates a traffic jam right at the junction of your throat. This is the sensation that keeps you hangjiong, clearing your throat, all morning. It's the congestion that makes you feel like you need to cough just to breathe. As we get older, there is a specific senior factor that complicates this further. First, we have to talk about your thirst mechanism. In our younger years, when our body needs water, the hypothalamus in our brain sends a very sharp, clear signal. Drink water now. However, as we cross the 60 and 70-year milestones, that signal often begins to dim. It becomes a whisper instead of a shout. Many of my patients aren't thirsty, but their tissues are actually parched. When you are even slightly dehydrated, your body tries to conserve water by stealing it from your mucus. This turns your biological flypaper into biological glue. Furthermore, we have to consider the American lifestyle, specifically our HVAC systems. We live in climate-controlled environments. In the winter, our heaters strip the moisture out of the air. In the summer, our air conditioners do the same thing. We are living in indoor deserts. Every breath you take in a dry house steals a little more moisture from that delicate throat lining, making the mucus thicker and the traffic jam worse. Understanding this science is the first step toward independence. You aren't just getting old. Your cleaning crew is simply overwhelmed by a highway that has become too dry and too crowded. Now that we understand the mechanics, we need to put on our detective hats. In my clinic, when a patient comes in complaining of chronic phlegm, I don't just look at their throat. I look at their lifestyle, their history, and their medicine cabinet. We are looking for the hidden culprits. Cause number 1, silent reflux, LPR, the master of disguise. If I had to pick the most common cause of chronic phlegm in seniors that gets misdiagnosed, it would be laryngopharyngeal reflux, or LPR. Most people know acid reflux as GERD, that burning sensation in your chest after a heavy meal. But LPR is far more cunning. It's called silent reflux for a reason. It often produces zero heartburn. Here is what is happening. Between your stomach and your esophagus, there is a circular muscle, a valve, designed to keep everything down. As the decades pass, that valve can lose some of its tension. In LPR, it's not necessarily a gallon of liquid acid splashing up. Instead, it's often acid vapors and digestive enzymes like pepsin. These vapors rise the esophagus like steam and settle on the delicate tissues of your larynx and pharynx, your throat. Your throat was never meant to handle stomach acid. It is incredibly sensitive. When these acidic vapors touch the throat lining, your body senses an emergency. It thinks, we are being burned, we need protection. And what is the body's primary defense? You guessed it, mucus. Your throat begins to produce a thick, heavy blanket of phlegm to shield itself from the acid vapors. Let me tell you about a patient of mine named Harold. Harold is 78, a retired engineer, and a very active member of his local community. For nearly 2 years, Harold lived with a constant lump in his throat. He cleared his throat so often during his morning bridge club that he started staying home out of embarrassment. He had seen 2 different specialists who told him his lungs were clear and his heart was fine. "It's just your age, Harold," they said. When Harold came to me, I asked him one question. "How was your voice in the morning?" He told me it was always raspy and hoarse for the first hour of the day. He didn't have heartburn, but he did have that lump feeling, what we call globus pharyngeus. We didn't give him cough syrup. Instead, we treated his stomach. We adjusted his evening meal times and gave him a simple plan to neutralize those vapors. Within 3 weeks, the age-related phlegm Harold had accepted as a life sentence was 90% gone. If you have a hoarse voice in the morning, a frequent need to clear your throat after eating, or the sensation of a noodle or lump stuck in your throat, silent reflux is likely your number 1 suspect. Cause number 2, the invisible drip, chronic post-nasal drip. The second culprit is what I call the invisible drip. We've all had a cold where our nose is running and we re-blowing it every 5 minutes. That's obvious. But post-nasal drip is different. It's like a leaky faucet in an upstairs bathroom that you can't see, but it's slowly dripping through the ceiling into the room below. In this case, the upstairs bathroom is your sinuses, and the room below is your throat. Your nose and sinuses actually produce about a quart of mucus every single day. Usually it's thin and slides down the back of your throat without you noticing. But when your sinuses become irritated, that mucus becomes thicker and more irritating. What triggers this? In the US, especially for those over 60, it's often allergies. You might think, I've never had allergies in my life. But the truth is, our immune systems change as we age. You can develop a sensitivity to dust mites in your mattress, pet dander from a beloved cat, or even mold spores in a damp basement that never bothered you before. This constant drip acts like an irritant, causing your throat to produce even more mucus in response. It becomes a vicious cycle. If you find yourself frequently swallowing or hawking up clear or white mucus, and your symptoms get worse when you're indoors or in bed, the invisible drip is likely the cause. Cause number 3. The forgotten dryness, dehydration. I cannot emphasize this enough. Water is the best expectorant on the planet. As I mentioned earlier, the viscosity of your mucus is determined by its water content. If you aren't drinking enough, your mucus turns from flypaper into glue. For my senior patients, this is a double-edged sword. Not only does the thirst signal weaken with age, but many seniors intentionally limit their water intake because they are tired of making trips to the bathroom in the middle of the night. I understand that frustration. But when you limit your fluids, you are effectively gluing your respiratory system together. This is compounded by the dry air in our modern American homes. If you wake up with a mouth that feels like it's full of cotton and a throat that feels like sandpaper, your phlegm isn't a disease. It's a cry for hydration. Without enough water, those microscopic brooms we talked about are trying to sweep through dried cement. They simply can't do it. Cause number 4, the echo of the past, chronic bronchitis and COPD. We must also be honest about our history. For many Americans in the 60-plus bracket, the echo of the past plays a role. If you were a smoker for 20, 30, or 40 years, even if you quit a decade ago, your lungs have undergone remodeling. In conditions like chronic bronchitis or COPD, the mucus-producing glands in your lungs have actually become enlarged. They are overtrained to produce phlegm because of years of irritation from smoke. This is the smoker's echo. It is vital to distinguish this from the other causes. Phlegm from LPR, or post-nasal drip, usually feels like it's in the throat. Phlegm from bronchitis or COPD feels like it's coming from deep in the chest. If your phlegm is consistently yellow, gray, or greenish, and is accompanied by a shortness of breath when you walk up a flight of stairs, this is a signal that your lungs need professional medical attention. It's not just getting older. It's a chronic inflammatory state that needs to be managed to protect your independence. Cause number 5, the pharmacy surprise. Finally, we have to look in your medicine cabinet. This is the pharmacy surprise. According to the CDC, nearly 70% of Americans over age 65 take at least one medication for blood pressure. One of the most common classes of these drugs are ACE inhibitors. You might know them by names like lisinopril, enalapril, or ramipril, anything ending in pril. These are life-saving drugs. They protect your heart and kidneys. However, they have a very strange and very common side effect. They can cause an accumulation of a substance called bradykinin in the airways. For about 10% to 20% of patients, this leads to a persistent, dry, tickling cough and the constant sensation of phlegm in the throat. Furthermore, many seniors take over-the-counter antihistamines to help them sleep or to manage drip. But here is the irony. Many of these older antihistamines, like Benadryl, have an anticholinergic effect. They dry you out. They might stop the drip, but they make the remaining mucus so thick that you can't clear it. You are trading one problem for another. If your phlegm issues started or worsened around the same time you started a new medication, you are not imagining it. You aren't aging fast. You are experiencing a side effect. Conclusion of the detective phase. I share these 5 causes with you because I want you to feel empowered. When you go to your next doctor's appointment, you don't have to just say, I have phlegm. You can now say, Doctor, I'm concerned about silent reflux, or could my lisinopril be causing this? When you understand the why, you regain the control. You move from being a frustrated patient to an active participant in your own health. In the next section, I'm going to show you exactly how to address these root causes with a clear, step-by-step plan that you can start right now, at home. You've been a great listener so far. If this is making sense to you, stay with me, because the solutions are often simpler than you think. Now that we have put on our detective hats and identified the likely culprits behind that persistent, sticky sensation in your throat, it is time to move from understanding to action. I don't want you to just live with it. I want to give you a clinical-grade roadmap that you can start today, right in your own kitchen and bedroom. This is the 4-step recovery plan. It isn't about expensive surgeries or complex prescriptions. It is about restoring the natural balance that your body has lost. Step 1. Smart hydration mastery. If there is one thing I find myself prescribing more than anything else in my practice, it is water. But for a senior, drinking more water is often easier said than done. As we discussed earlier, your thirst signals aren't as sharp as they used to be. You might not feel thirsty, but your tissues and your mucus are parched. To master hydration, we need a rule of thumb. In clinical terms, we often use the 35 mmol x weight rule. Here is how you do the math. Take your weight in kilograms and multiply it by 35. That gives you the total milliliters of fluid you need daily. For my American patients who use pounds, a simpler way to think about it is this. Aim for about ½ ounce to 2/3 of an ounce of water for every pound you weigh. So, if you weigh 150 pounds, you should be aiming for roughly 75 to 100 ounces of fluid a day. I know that sounds like a lot, especially if you're worried about extra trips to the bathroom. But remember, we aren't just talking about plain cold water. We are talking about smart hydration, the secret of temperature. Why warm beats cold? In the United States, we have a cultural obsession with ice-cold drinks. We put ice in everything. But if you are struggling with chronic phlegm, your ice water habit might be part of the problem. Think about what happens to candle wax when it's cold. It's hard, brittle, and stuck. What happens when you apply heat? It thins out and flows. Your mucus behaves in a very similar way. Cold liquids can actually cause the tiny blood vessels in your throat to constrict and can temporarily stun those microscopic brooms, the cilia, we talked about earlier. Warm liquids, on the other hand, act like a gentle solvent. The heat helps to break the molecular bonds of the mucus, making it thinner and easier to sweep away. Steam from a warm drink also moisturizes the upper respiratory tract directly as you sip. Dr. Whitman's recommended clearing infusions. I want you to replace 2 of your daily cold drinks with one of these 4 specific infusions. Each of these has a biological reason for being on this list. Ginger and lemon water. Ginger contains powerful compounds called gingerols. In the lab, gingerols have been shown to have anti-inflammatory effects that are specifically effective on the tissues of the throat. The lemon provides a hit of acidity that can help break up the biofilm of the mucus. Thyme tea. This is an old-world remedy that has modern clinical backing. Thyme contains thymol, which is a natural expectorant. It actually signals your cleaning crew, the cilia, to work a little faster. It's one of the best herbs for thinning deep-seated phlegm. Peppermint tea. The menthol in peppermint acts as a natural decongestant. It doesn't just make your breath smell good. It helps open up the airways and provides a cooling sensation that can soothe the lump in the throat, feeling caused by silent reflux. Chamomile with a hint of honey. I recommend this specifically for the evening. Chamomile is a natural anti-inflammatory, and as we will discuss in step 3, honey is nature's most effective throat sealant. Start your day with 8 ounces of warm water and a squeeze of lemon before you even touch your coffee. This primes the pump for your cleaning crew and helps wash away the mucus that accumulated while you slept. Step 2. Environmental control, creating your sleep oasis. Most people don't realize that they spend 1/3 of their lives in their bedroom. For many seniors, that bedroom is an indoor desert. Between the central heating in the winter and the air conditioning in the summer, the humidity in American homes often drops below 20%. For context, the Sahara Desert averages about 25% humidity. You are literally breathing desert air for 8 hours a night. This air robs moisture from your throat with every breath, turning your mucus into a thick, dry crust. The humidifier protocol. I want you to turn your bedroom into a sleep oasis. To do this, you need a cool mist humidifier. Why cool mist? For seniors, I prefer cool mist over warm mist because it's safer, no risk of burns, and doesn't promote mold growth as easily in the room. Your goal is to keep your bedroom humidity between 40% and 50%. You can buy a tiny device called a hygrometer for less than $10 at any hardware store to monitor this. If the humidity goes above 60%, you risk mold, which will make your phlegm worse. If it's below 30%, your throat will stay dry. Pro tip: you must clean your humidifier every 2 to 3 days with white vinegar. If you don't, you are just pumping bacteria and mold into the air, which is the last thing your flypaper needs to catch. The spa alternative: free techniques. If you don't have a humidifier, you can use the steam shower technique. Before you go to bed, turn on the hot water in your shower and let the bathroom fill with steam. Sit in the bathroom, not in the water, for 10 to 15 minutes and just breathe deeply. This is a direct, intensive hydration treatment for your vocal cords and throat. Alternatively, you can use the hot bowl method. Fill a bowl with steaming, not boiling water. Place a towel over your head and inhale. This sends warm, moist air directly to the traffic jam. Doing this for just 5 minutes before bed can significantly reduce the morning gunk you feel the next day. Step 3. Natural cleaning protocols. Sometimes the mucus is so stubborn that we need a more manual way to help the cleaning crew. These are the protocols I've seen work wonders for patients who have suffered for years. The science of saltwater gargles. Your grandmother was right about this one, but she probably didn't explain the physics of why it works. It's called osmosis. When your throat is inflamed, whether from reflux or a drip, the tissues become swollen with excess fluid. By gargling with warm salt water, half a teaspoon of salt in 8 ounces of water, you are creating a high salt environment outside the cells. Physics dictates that the water inside the swollen, inflamed cells will be drawn out toward the salt. This reduces swelling, thins the mucus that is stuck to the tissue, and helps disinfect the area. I want you to gargle for at least 30 seconds, twice a day. Don't just swish. Get the water back toward the traffic jam area. Pure honey, the natural sealant. In a famous study conducted at Penn State, researchers found that buckwheat honey was actually more effective than common over-the-counter cough suppressants, like dextromethorphan, for calming nighttime irritation. Honey works by creating a biofilm, or a protective sealant, over the irritated nerve endings in your throat. This is especially helpful if your phlegm is caused by silent reflux. A single teaspoon of raw local honey before bed can act as a shield, preventing the acid vapors from irritating the throat while you sleep. The nasal rinse, the neti pot. If your detective work pointed to post-nasal drip, cause number 2, this step is non-negotiable. You have to wash the upstairs bathroom. A saline nasal rinse, using a neti pot or a squeeze bottle, physically flushes out the allergens, dust, and thick mucus from your sinuses before they can drip down into your throat. Critical safety note. For my American patients, please listen carefully. You must never use tap water for a nasal rinse. Tap water can contain microscopic organisms that are safe to drink, but can be fatal if they enter the sinuses. Use only distilled, sterile, or previously boiled water that has cooled down. This is an essential safety rule for anyone, but especially for seniors. Step 4. Cause-specific lifestyle adjustments. Finally, we have to talk about the long game. We have to adjust the habits that are fueling the fire. The gravity hack for reflux. If we suspect silent reflux (LPR) is the culprit, we have to use gravity to our advantage. Remember, reflux often happens because that valve between your stomach and esophagus is a bit relaxed. When you lie flat on your back, it's very easy for acid vapors to travel downhill into your throat. I want you to elevate the head of your bed by 6 to 8 inches. I don't mean using extra pillows. Extra pillows just bend your neck and can actually increase pressure on your stomach. I mean using a wedge pillow or putting actual bed risers, or wooden blocks under the two legs at the head of your bed. This creates a gentle slope that keeps the acid in your stomach where it belongs. The 3-hour fasting rule. This is the hardest but most effective change for my patients. I want you to finish your last meal or snack at least 3 hours before you lie down. If you eat a bowl of ice cream or some crackers and then go to bed 30 minutes later, your stomach is full of acid and enzymes and you are lying flat. It's a recipe for a phlegm disaster in the morning. Give your stomach time to empty before you ask it to defy gravity. Allergy hygiene. If allergies are your trigger, we have to look at your mattress. A mattress can hold millions of dust mites. I recommend a dust mite-proof, zippered mattress cover and washing your sheets in hot water, at least 130 degrees once a week. Also, consider a HEPA air purifier for your bedroom. A HEPA filter can trap 99.97% of the particles that your flypaper mucus would otherwise have to catch. I am a big believer in the power of natural recovery and lifestyle changes. I have seen thousands of patients regain their independence and clear their throats using the steps I just laid out. However, as a physician, I also have a responsibility to tell you when natural isn't enough. Because we are dealing with the respiratory system, there are certain red flags that you should never ignore. If you experience any of the following, please do not wait. Make an appointment with your primary care physician or go to an urgent care center immediately. Blood in your phlegm. If you see streaks of bright red, pink, or rusty brown in what you cough up, this needs an immediate evaluation. It could be something simple, but it could also be a sign of something more serious in the lungs. Difficulty breathing or wheezing. If the phlegm is accompanied by a feeling that you can't get a full breath, or if you hear a whistling sound when you breathe, wheezing, this indicates that the inflammation has moved deep into the bronchial tubes. Fever and chills. If your phlegm is thick, dark green or yellow, and you have a fever over 101 degrees, you may have a bacterial infection like pneumonia or acute bronchitis that requires antibiotics. Unexplained weight loss. If you are losing weight without trying, and you have a chronic cough or phlegm, this is a signal from your body that needs a thorough medical workup. Difficulty swallowing. If it feels like food is actually getting stuck on the way down, not just a lump sensation but actual blockage, this requires a specialist, a gastroenterologist, to look at the esophagus. Dr. Whitman's professional disclaimer. My goal with this video is to empower you. In our modern medical system, doctors are often rushed. They have 15 minutes to see you, and often the easiest thing to do is to say, "It's just age," and hand you a prescription for a cough syrup that doesn't work. I want you to use this information to be your own best advocate. Take these notes to your doctor. Say, "Doctor, I've been working on my hydration and using a humidifier, but I'm still having this issue. Could we check for silent reflux or review my blood pressure medication?" This video is for educational purposes. It is meant to support the relationship you have with your doctor, not replace it. You are the CEO of your own health. My job is just to provide you with the best data possible so you can make the best decisions for your life. If there is one thing I want you to take away today, it is that the greatest danger isn't the phlegm itself, but the silent, cumulative irritation that we've all been taught to ignore as just part of aging. You might have spent years clearing your throat after a late dinner or taking your daily medications on autopilot, never realizing these small, unconscious habits were slowly overwhelming your body's natural defenses. Please understand, this isn't because you were careless. It's simply because our healthcare system rarely takes the time to explain these hidden connections clearly. The good news is that you are not a victim of your age. By making these small adjustments to your environment and hydration, you are reclaiming the independence and quality of life that you deserve. If this realization resonates with you, please just type "taking control" in the comments below. I invite you to subscribe to this channel as a vital safeguard for your health, rather than just another source of entertainment. In our next conversation, we will look at a signal that is even more common, involving your kidneys, which is often missed even earlier than a cough. I share this with you because I've met too many patients who only wish they had known these things sooner. Take care of yourself.